Hi, this is Amy Cooper. This is my clinical debriefing video. So the nurse in this scenario exhibited little caring. She did communicate with the patient face to face. She introduced herself and she let her know why she was there. She also provided some educational teaching to the patient where it was needed, and she asked her a few questions. When she was finished with the patient, she went out and had some discussion with a fellow coworker. Some of that was showing care and concern that, she didn't have a home. She was really only concerned with getting pain medicines. But then the nurse's tone turned fairly judgmental and was uncaring at that point. So that really was all the caring that I observed in the scenario. Overall, I think the entire scenario was fairly irritating to watch as a nurse. There were so many non-caring behaviors that this nurse exhibited. She did introduce herself. She didn't explain her purpose, but she didn't ask the patient how she was. She made no attempts at any major conversation with her. What's your name? How are you feeling? What's going on? Any concerns? Nothing like that. She was also pretty dismissive. When the patient made certain statements, she was pretty dismissive to them. She did not investigate any further. She did not ask any clarifying questions. There were even several times where I felt that the nurse kind of cut the patient off when the patient was answering questions. The patient stated that she didn't have a home. That comment was completely ignored. There was no investigating to did she really mean she has no home or something else, but there was no probing questions whatsoever. Also, the patient seemed to be just concerned with pain medicine, getting Percocet. The nurse explained that she was not getting Percocet, she was getting Motrin, and the patient said the Motrin made her stomach upset. Again, the nurse did not make any attempts to find out, are you having pain that the Motrin won't help, and that's why you want the Percocet? Is there just a lack of knowledge as far as pain control? What are you doing when you take the Motrin? There was nothing to say, oh, well, you need to take some food with that Motrin if it upsets your stomach, or maybe we can try Tylenol. The only thing that she offered was that she could talk to her doctor about it in her 2-week follow-up visit, which is not appropriate at all. She was also very rushed and impatient during the discharge process. Like, who's picking you up? We really need to know. It's super busy out there. We need to get this going. That's all very rushed and non-caring. It's not providing good care. So first thing that I would do is most definitely develop a trusting relationship with this patient. This young mother having some type of trusting working relationship is going to be vital. Providing education in simple, easy terms that she can understand. Explain the diaper changing process. Have her change the diaper, but be there to provide assistance or suggestions, and be available to answer any questions. Also, definitely ask probing questions about her home situation and the pain, so we can get that managed and get her to a place safe for her and the baby. Definitely with a caring and compassionate tone. Never let her, even if I am rushed, never pass that on to the patient. She should be your one and only care and concern at the time when you're in there talking to her. Really making sure case management and social workers are involved in her case so that they can help provide her with the resources or get her those resources that she's going to need to take care of this baby. The patient priorities did really seem to be pain management, and also, hey, does my baby look cute? This is all very typical young mother, teenage expressions. It's really evident that this situation, the reality of this situation has not yet set in for her. So making sure that you provide education and really ask questions, really delve into where she's at mentally, so you can help her out the best. The nurses at priorities were, let's get her discharged, educated, the minimal, no reinforcement, no evidence of learning. Let's just get it done. Let's get her out. I need to check these boxes off and get on to my next. That was really appeared to be the nurse's main priority. There's so many resources available to this patient. Care management should have been involved because they have even more access to resources than we do as nurses. There's lots of community outreach programs that can help her get her emergency housing and then set her up with assistance to find permanent housing. There's so many programs, whether they're community, state, federal, local, all those above, help the mother with WIC, providing the basic staples of food for the baby. There's local food pantries, there's local mother groups, even the hospital sometimes have parenting classes, FAMUS, other health clinics that are free or low income are all resources that can be vital for helping this mother. This scenario is a great reminder of what we should not be doing as nurses. We need to be providing the caring and compassionate care without those judgments or biases. Poor communications can be detrimental to a patient's health, especially the vulnerable populations where they're already at risk for mistreatment and subpar care. Their access is limited, and we have limited time to help them, to educate them, and get them on the right path.